Think back to the last time you stepped into your garage, a basement, or maybe a storage shed to grab something untouched for months. Perhaps it was holiday decorations, old tools, or a box you've been promising yourself to sort someday. You moved a few boxes, maybe noticed a layer of dust, or brushed past a few tiny droppings. Then, just like that, you walked out and forgot about it entirely. Now imagine this ordinary 5-minute errand could have brought you face to face with one of North America's most stealthy pathogens. No bite, no scratch, no direct contact with a living animal, simply by inhaling the air. That silent exposure is what sets Hantavirus apart from almost every other virus most adults have been warned about in recent years. Today, we'll unpack the reality of this virus in a way that avoids the panic-driven headlines and gives you practical, actionable insight. By the end of this discussion, you will understand exactly what Hantavirus is, how it enters the human body, what it does once inside, why men and women over 60 carry specific risk factors, and the precise steps you can take right now to protect yourself and loved ones. Before diving deeper, there's a concept in infectious disease medicine rarely covered in mainstream media. I call it the quiet window problem, and it is crucial for grasping your true exposure risk. Keep that phrase in mind as we move forward, because it fundamentally changes how you think about encountering this virus. Let's start by grounding this discussion in biology rather than media hype. The term Hantavirus often appears in news coverage as if it represents a singular threat. In reality, it is a family of viruses, with over 40 known species, an inventory that has expanded as genomic sequencing technology has advanced. These viruses have circulated among rodent populations for decades, occasionally infecting humans. The name originates from the Hantan River in South Korea, where researchers in the 1970s first identified one strain while investigating illness patterns in soldiers stationed near the Korean border. Here's the piece missing from most news coverage. Hantavirus is not a new pathogen. Scientists have studied it for over 50 years. Its biology, transmission methods, and clinical effects are well documented. The reason it surfaces in headlines repeatedly is not because it has suddenly appeared. It has been present continuously across North America, Europe, Asia, and South America. What changes is human behavior, the circumstances that bring people into the specific environments where the virus resides. Whenever you read health headlines, ask this fundamental question. Is the pathogen novel or well-known? Novel viruses, for which humans have no prior immunity and no established understanding of transmission or treatment, justify widespread concern. Early 2020 saw this with SARS-CoV-2. Hantavirus does not fall into that category. Its transmission patterns are understood, clinical manifestations are recognized, and the scientific community has established management protocols. That said, familiarity does not mean it should be ignored. It means we can respond intelligently. Now let's examine how the virus spreads, as this is widely misunderstood. Many assume Hantavirus spreads like COVID-19, from person to person through shared indoor air in confined spaces. That assumption is incorrect and crucial for evaluating risk. Most strains circulating in North America and globally are not transmitted between humans. They are rodent-borne, carried in the urine, feces, and saliva of certain species. In North America, the deer mouse is the primary reservoir, while other rodents carry different strains across Europe and Asia. The truly dangerous mechanism lies in what happens after rodents leave their traces. Urine, feces, and saliva do not need to be fresh to pose a threat. Over time, these substances dry, breaking down into microscopic particles invisible to the eye, odorless, and undetectable by any of our senses. In enclosed spaces, attics, seldom used basements, winter-closed cabins, barns, or storage sheds, these particles linger in the air. When disturbed by movement, they become airborne. Breathing them in constitutes the exposure event. It happens silently. You feel fine, nothing alerts your body, and yet the virus has entered. This is the essence of the quiet window problem. Before exploring the quiet window in detail, it's vital to know the safe cleaning protocol for spaces with rodent activity. If you encounter droppings, nesting material, or gnaw marks, follow these steps. First, ventilate the area by opening all windows and doors, and wait at least 30 minutes before entering. Second, wear an N95-rated respirator, not a cloth or surgical mask, and put on rubber or plastic gloves to protect your hands. Third, prepare a disinfectant by mixing 1 part household bleach with 10 parts water. This sequence is non-negotiable to reduce the risk of inhaling airborne viral particles. Understanding hantavirus requires moving past fear-driven reporting to see the virus in biological and environmental context. It is not new, it is not emerging, and it is not transmitted person to person. Instead, it is a persistent presence in rodent populations, with exposure largely determined by human interaction with contaminated environments. Recognizing the quiet window problem, the silent period between inhalation and symptom onset, empowers adults over 60 to take practical protective measures immediately. By ventilating, masking, and disinfecting spaces with signs of rodent activity, you dramatically reduce the chance of an invisible encounter with this stealthy pathogen. Your first line of defense against hantavirus exposure is the correct surface treatment. Start by thoroughly wetting the contaminated areas with a disinfectant before touching or moving anything. This step neutralizes viral particles before they can become airborne. Never sweep dry or use a vacuum without a HEPA filtration system. Both actions propel particles into the air you breathe. Double bag all waste materials and discard gloves and masks afterward. Wash your hands with soap and water. Following this protocol in the proper sequence significantly lowers your risk. It's straightforward, yet precision matters. Every step in the right order counts. Now let's examine what happens inside the body when hantavirus takes hold. There are two main disease forms, each operating through distinct mechanisms. Understanding both is especially important for adults over 60 because common age-related health patterns influence how each form manifests. The first is hantavirus pulmonary syndrome, or HPS, most commonly seen in North and South America. Initial symptoms mimic influenza: fatigue, muscle pain, fever, headaches, occasional nausea, or dizziness. Many adults dismiss these signs as a routine seasonal bug and manage with rest and hydration at home. Then, typically between 3 and 7 days after symptoms appear, the situation changes. The virus, silently replicating in the bloodstream, begins damaging small blood vessels in the lungs. Fluid accumulates in lung tissue, and oxygen levels start to drop. What makes HPS particularly dangerous is the speed of decline. It is not a slow deterioration over weeks. In severe cases, someone functional yesterday can experience acute respiratory distress within 24 hours. The case fatality rate for hantavirus pulmonary syndrome is approximately 35 to 38%. Roughly 1 in 3 individuals who develop the full syndrome does not survive. This is a significant statistic demanding serious attention. The second presentation, hemorrhagic fever with renal syndrome, or HFRS, predominates in Europe and Asia. Here, the virus primarily targets the kidneys, causing inflammation, internal bleeding, and, in severe cases, acute kidney failure requiring dialysis. The overall fatality rate ranges from 1 to 15%, depending on the strain. Strains like Hantan and D. rava are at the severe end, while others, such as Puma, tend to cause milder illness with fatality below 1%. Even at 1%, kidney involvement represents a serious medical issue. For older adults, the nuance is critical. Existing kidney disease, reduced renal function, or conditions like hypertension or diabetes increase vulnerability. These factors place the kidneys under chronic stress, leaving less margin for deterioration before organ failure becomes critical. Pulmonary syndrome follows a similar pattern. Conditions common in this age group, COPD, reduced lung capacity, sleep apnea, or cardiovascular disease, accelerate the onset of oxygen crises. Awareness is key, not alarm. Understanding these nuances informs the threshold for seeking emergency care. Returning to the quiet window problem, this concept explains why hantavirus is uniquely challenging. Most strains incubate between 1 week and 8 weeks. For the Andes virus implicated in the recent cruise ship outbreak, the documented incubation ranges from 4 to 42 days, with most cases emerging between the 2nd and 4th week after exposure. Consider that carefully. A person could be exposed during a 5-minute trip to a storage space and show no signs for as long as 56 days. They continue daily life, feeling completely normal, while the virus quietly replicates and interacts with their immune system at the cellular level. Symptoms appear suddenly, often when significant organ involvement has already occurred. This disconnect, the lengthy silent period between exposure and symptom onset, is the essence of the quiet window. A March visit to a shed may not be connected in a person's mind to fever and muscle aches in late April. They may assume influenza, delay care, and lose crucial hours or days that could impact outcomes. Unlike novel pathogens, where antivirals may be developed, Hantavirus has no approved targeted medication. Early intervention relies on prompt recognition, escalation to emergency care, and clear communication with medical professionals. Here is exactly what to tell a doctor if recent rodent exposure is suspected. I was in an enclosed space with evidence of rodent activity approximately a certain number of weeks ago. I am aware of Hantavirus and want it considered in the differential diagnosis. This statement triggers early consideration, ensuring supportive care, oxygen, fluid management, and respiratory monitoring begins at the earliest, most effective point. The critical window for optimal intervention is measured in hours, not days. Recognize the symptom triad: fever, pronounced muscle aches, and progressively worsening shortness of breath occurring within 1 to 8 weeks after any potential rodent contact. Understanding this framework allows adults over 60 to act decisively before complications escalate, bridging the gap between silent exposure and meaningful medical action. That combination of fever, severe muscle aches, and progressively worsening shortness of breath is your signal to act immediately. This is not a moment to wait, not a chance to assume it's just a seasonal illness. You must move. Now let's examine the global perspective, because this is where public perception often misinterprets the facts. Both the World Health Organization and the Centers for Disease Control have concluded that population-level risk from Hantavirus is low. If you read those statements and felt reassured, that response is understandable. However, it is important to recognize why that reassurance may not reflect your personal situation. Population-level statistics are derived from averaging both the likelihood of exposure and the severity of outcomes across large, highly diverse groups. These include urban and suburban dwellers, residents of high-rise apartments with no history of rodent contact, and populations in countries with well-established rodent control measures. When you average all these groups, the overall number appears low. Your individual risk, however, is not dictated by broad population data. It is determined by your unique circumstances. If you spend time in rural or semi-rural areas, a vacation cabin, a hunting lodge, or a family farm, your exposure environment is very different from someone living exclusively in climate-controlled urban buildings. Jobs involving older structures, soil, outdoor work, wildlife, pest control, or agriculture carry occupational exposure that general population averages do not capture. Similarly, renovating, clearing, or cleaning unoccupied or rodent-accessible spaces increases your personal risk significantly. Low global risk is accurate, but it alone is insufficient for making informed personal health decisions. Another point worth noting: the Andes virus, found in parts of South America, has documented person-to-person transmission. This characteristic is rare among Hantavirus strains. While transmission efficiency remains limited, it explains why the current cruise ship investigation is being closely monitored. For all other major strains, including those most relevant to North American and European audiences, infection occurs primarily through rodent exposure. Human-to-human transmission is not a documented route for these strains. There is a critical underlying factor for older adults: immune aging. At 65, your immune system is not the same as it was at 35. This is a biological reality with real-world implications. The process, called immunosenescence, gradually shifts immune function over decades. Response speed, accuracy in recognizing novel threats, and the ability to mount and then regulate inflammation all decline somewhat with age. Practically, this means your immune system may be slower to detect viral threats like Hantavirus, and the organs it needs to defend begin with reduced physiological reserve. Several factors within your control can influence immune efficiency in this age group. Sleep is the most undervalued lever. Regular, high-quality sleep of 7 or more hours nightly is essential for immune surveillance and cellular repair. Chronic sleep deprivation weakens these functions measurably. Vitamin D deficiency is disproportionately common in adults over 60, especially those spending limited time outdoors. Low vitamin D impairs immune response speed and cascade quality. A simple 25-hydroxy vitamin D blood test provides actionable insight. Ask your physician. Chronic inflammation caused by metabolic factors, high blood sugar, excess visceral fat, and sedentary habits constantly drains immune resources. An immune system managing low-level inflammation has less capacity for acute pathogen responses. Individuals managing kidney disease, hypertension, diabetes, COPD, or cardiovascular conditions should discuss any adjustments to their health routines directly with their physician. The interaction between pre-existing conditions and the organ systems targeted by Hantavirus makes personal medical history critical in assessing risk. Here is a clear summary of what you need to understand and do. Hantavirus is a known, well-studied virus family, not an emerging pathogen. It does not transmit through casual human contact. Infection occurs via inhaling microscopic particles from dried rodent excretions in enclosed, poorly ventilated spaces. Exposure is silent, odorless, and completely undetectable at the moment it happens. The incubation period ranges from 1 week to 8 weeks for most strains, and for the Andes virus from 4 to 42 days. This lengthy interval, the quiet window, makes awareness and preparedness far more valuable than reactive responses after symptoms appear. The symptom triad to remember is fever, significant muscle aches, and progressive shortness of breath. If these occur within 2 months of any potential rodent exposure, seek emergency medical care immediately and provide a detailed exposure history. Delay is dangerous. Anyone with access to rural properties, older structures, unoccupied spaces, or occupational environments with rodent risk should assess exposure now. If cleaning is necessary, strictly follow the ventilate, mask, wet surfaces, never dry sweep protocol step by step. If your baseline immune health needs improvement, address sleep, vitamin D status, and inflammation management in consultation with your doctor. Finally, reflect on your own environment. Do you have a cabin, basement, storage unit, or shed that may harbor rodent activity? Has this information prompted action? Consider also your initial reaction when you first saw Hantavirus in the news: fear, dismissal, curiosity. These reflections reveal the community's health literacy and where it needs to advance. Share this knowledge with anyone receiving alarming headlines. Context, not panic, is what is needed. Stay informed, act rationally, and prioritize your health. No one else will advocate for it on your behalf. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.